Welcome to Ortho Reports. Today, we're diving into a high-stakes medical showdown. Imagine you shatter your wrist. How should surgeons piece it back together? Well, a recent study put two very different techniques to the test to find out. So, let's get right into it.
First off, let's set the stage with a number, 16%. That's the percentage of all fractures that show up in the emergency room that are actually a broken wrist. So yeah, this is an incredibly common injury. But here's the thing. Not all breaks are created equal, right? A simple crack is one thing, but what happens when the bone doesn't just break, it shatters into a bunch of pieces right there at the joint? That is the gnarly problem this new research is tackling.
To really understand this fight, we first have to understand the battlefield itself. For a surgeon, trying to put all those little shattered pieces back together perfectly is a massive challenge. The goal, of course, is to get that joint working again so you can have a wrist and fingers that are mobile and pain-free. The fancy clinical name for this is a comminuted distal radius fracture. Comminuted just means the bone is in multiple fragments, and when that shatter happens right at the joint, you better believe the stakes for a full recovery get much, much higher. So how do you even begin to fix something like that? Well, surgeons have been debating the best way for years. This study zeroes in on two of the leading contenders. One is a tried-and-true conventional method, and the other is a more modern alternative. First up, we've got the old guard, external fixation, or ExFix for short. The easiest way to picture this is like an external scaffold. Just like you see here, surgeons put pins into the healthy bone on either side of the fracture, and then this external metal frame holds everything right where it needs to be, giving those shattered pieces a chance to heal. And then you've got the newcomer, dorsal bridge plating. This is a completely different approach. Instead of a big frame on the outside, the surgeon goes in, puts a specially designed metal plate right onto the bone, underneath the skin, and creates this really sturdy internal brace to hold the whole thing together. So the most important thing to get here is this. One method, external fixation, builds that scaffold on the outside of the arm. The other one, dorsal plating, builds a brace on the inside. Both are shooting for the same results, but as you can imagine, the patient's experience is completely different. So with two competing ways to fix this, researchers really wanted to know which one is actually better for patients. And to do that, they set up a direct head-to-head comparison, which is really the gold standard in medical research. What they did was a randomized controlled trial. They took 30 patients, all with these really severe wrist fractures, and randomly put them into one of two groups. Then they followed them super carefully for months, tracking everything from their x-rays and range of motion to their own personal experience of it all. This whole careful setup was designed to get a clear answer. Would the old, trusted external scaffold win the day, or would the modern internal brace be crowned the champion? And this is where things get really fascinating, because the results, well, they were pretty surprising. It wasn't a simple knockout, it was more like a split decision, where the winner really depended on how you were scoring the fight. So, let's start with the long-term outcome. At the 6-month mark, when the doctors were looking at the x-rays and measuring how the wrist actually worked, both groups were pretty much indistinguishable. So in the end, both techniques led to a well-healed wrist. And this is the real story of the study, because even though the final destination was the same, the journey to get there was just worlds apart for these two groups of patients. The experience of healing, well, it turned out to matter a whole lot. Now, take a look at this. This is where the hard data really starts to paint a picture. The group that got the dorsal plate had 0 infections, 0 cases of late carpal tunnel syndrome, and, this is a big one, 0 cases of loss of reduction, which means the bone fragments didn't slip out of place. The external fixator group, though, they had cases of all 3, with 5 patients actually having their fractures shift after surgery. But the differences went way beyond the clinical data. This quote from the study really gets to the human cost. Patients with that external frame, the metal rods sticking out of their arm, they felt a real social stigma. The device itself was this constant, visible reminder of their injury. And that difference just becomes crystal clear when you look at the patient satisfaction scores. I mean, the chart shows a massive gap. The patients with the internal plate found it way easier to do simple daily things, like getting dressed, eating, sleeping. They were also just happier with how their wrist looked after it healed. In contrast, the folks with the external frame, they reported a lot more challenges all across the board. So let's move into our final section and see how all of this builds to the study's really powerful conclusion. It's not just about the final X-ray, it's about the entire healing process. So here it is, the key takeaway, pulled right from the research. While both methods work in the long run, that internal dorsal plating just provided a smoother, safer, and honestly, a much more satisfying recovery journey for the patient. To sum it all up, the advantage of the internal plate was absolutely clear during that critical healing phase. It meant fewer infections, less trouble with daily tasks, no bulky external hardware to deal with, and at the end of the day, happier patients who were just more satisfied with their care. And that leaves us with this final thought. In medicine, when you have two treatments that lead to the same clinical outcome, how much weight should we really give to the patient's experience along the way? Well, this study suggests it matters immensely. Thanks for joining us.